Clinical management of severe acute respiratory infection when COVID-19 is suspected. This document is intended for clinicians taking care of hospitalized adult and pediatric patients with severe acute respiratory infection (SARS) when a nCoV infection is suspected. It is not meant to replace clinical judgment or specialist consultation but rather to strengthen clinical management of these patients and provide up-to-date guidance. Best practices for SARS including IPC and optimized supportive care for severely ill patients are essential. Access the document. Clinical Care of Severe Acute Respiratory Infections Toolkit. This toolkit is intended for clinicians working in acute care hospitals in low and middle income countries, managing adult and pediatric patients with acute respiratory infection, including severe pneumonia, acute respiratory distress syndrome, sepsis and septic shock. The main objective is to provide some of the necessary tools that can be used to care for the critically ill patient from hospital entry to hospital discharge. Access the document. Recommendations, Pre-Hospital Emergency Medical Services (EMS) COVID-19. This document provides general guidance for emergency medical service (EMS) preparedness and response to COVID-19 and is directed to EMS providers. Pre-hospital workers, including EMS personnel and other emergency responders, may potentially be exposed to the disease through patient contact or through contaminated environments. It is paramount that providers follow specific practice guidelines to mitigate the effects of an escalating pandemic. Access the publication. Severe Acute Respiratory Infections Treatment Center Practical Manual to set up and manage a SARS treatment center and a SARS screening. Access the publication. Considerations for quarantine of individuals in the context of containment for coronavirus disease COVID-19. The purpose of this document is to offer guidance to member states on quarantine measures for individuals in the context of COVID-19. It is intended for those responsible for establishing local or national policy for quarantine of individuals, and adherence to infection prevention and control measures. Access the publication. Home care for patients with suspected novel coronavirus (nCoV) infection presenting with mild symptoms and management of contacts. WHO has developed this rapid advice note to meet the need for recommendations on the safe home care for patients with suspected novel coronavirus 2019 nCoV infection presenting with mild symptoms and public health measures related to management of asymptomatic contacts. Access the document. Operational considerations for case management of COVID-19 in health facility and community. This document is intended to guide the care of COVID-19 patients as the response capacity of health systems is challenged, to ensure that COVID-19 patients can access life-saving treatment, without compromising public health objectives and safety of health workers. It promotes two key messages. 1. Key public health interventions regardless of transmission scenario, and 2. Key action steps to be taken by transmission scenario to enable timely surge of clinical operations. Access the publication. Maintaining a safe and adequate blood supply during the pandemic outbreak of coronavirus disease COVID-19. This document provides interim guidance on the management of the blood supply in response to the pandemic outbreak of coronavirus disease COVID-19. It emphasizes the importance of being prepared and responding quickly and outlines key actions and measures that the blood services should take to mitigate the potential risk to the safety and sufficiency of the blood supplies during the pandemic. It should be read in conjunction with WHO guidance for national blood services on protecting the blood supply during infectious disease outbreaks, which provides general guidance on the development of national plans to respond to any emerging infectious threats to the sufficiency or safety of the blood supply. Access the document. Global COVID-19 Clinical Characterization Case Record Form and New Data Platform for Anonymized COVID-19 Clinical Data. The Rapid Clinical Characterization Case Record Form (Clinical CRF) is intended to provide member states with a standardized approach to collect clinical data in order to better understand the natural history of disease and describe clinical phenotypes and treatment interventions, i.e. clinical characterization. By using one standardized clinical data tool, there is potential for clinical data from around the world to be aggregated, in order to learn more to inform the public health response and prepare for large-scale clinical trials. The Clinical Characterization Case Record Form (Clinical CRF) is intended to provide member states with a standardized approach to collect clinical data in order to better understand the natural history of disease and describe clinical phenotypes and treatment interventions, i.e. clinical characterization. By using one standardized clinical data tool, there is potential for clinical data from around the world to be aggregated, in order to learn more to inform the public health response and prepare for large-scale clinical trials. Access the Rapid Case Record Form. Access the Pregnancy Module of Case Report Form. Data Platform for Anonymized COVID-19 Clinical Data in Response to the Coronavirus Disease 2019 COVID-19 epidemic. The World Health Organization (WHO) is launching a global COVID-19 anonymized clinical data platform, the COVID-19 Data Platform, to enable state parties to the International Health Regulations (IHR) 2005 to share with WHO anonymized clinical data and information related to patients with suspected or confirmed infections with the 2019 nCoV, collectively, anonymized COVID-19 data. The anonymized COVID-19 data received from state parties through the COVID-19 data platform will remain property of the contributing state party and will be used by WHO for purposes of verification, assessment and assistance pursuant to the IHR 2005, including to inform the public health and clinical operation response in connection with the COVID-19 outbreak. To help achieve such purposes, WHO will establish an independent clinical advisory group to advise WHO on global reporting and analysis of the anonymized COVID-19 data. State parties are invited to contribute anonymized COVID-19 data to the COVID-19 data platform. State parties should please contact WHO at edcarn@who.in to obtain more information about, including log-in credentials for, the COVID-19 platform. To preserve the security and confidentiality of the anonymized COVID-19 data, state parties are respectfully requested to take all necessary measures to protect their respective log-in credentials and passwords to the COVID-19 data platform. The anonymized COVID-19 data will be stored in the COVID-19 data platform, which is a secured, access-limited, password-protected electronic platform that is hosted on behalf of WHO by a third-party platform provider. WHO and such party have entered into contractual arrangements requiring the latter, among other things, to protect the confidentiality and prevent the unauthorized disclosure of the anonymized COVID-19 data, to refrain from using the anonymized COVID-19 data for any purpose other than providing hosting services to WHO in accordance with the contractual arrangements, and to implement and maintain appropriate technical and organizational security measures to protect the security of the anonymized COVID-19 data and the COVID-19 data platform. In accordance with Article 11(4) of the IHR 2005, WHO will not make the anonymized COVID-19 data generally available to other state parties until such time as any of the conditions set forth in paragraph 2 of such Article 11 are first met and following consultation with affected countries. Pursuant to that same Article 11, WHO will not make anonymized COVID-19 data available to the public, unless and until anonymized COVID-19 data has already been made available to state parties, and provided that other information about the COVID-19 epidemic has already become publicly available and there is a need for the dissemination of authoritative and independent information. For more information, please contact edcarn@who.in. Show less show more. WHO COVID-19 Essential Supplies Forecasting Tool. The WHO COVID-19 Essential Supplies Forecasting Tool (ESFT) is designed to help governments, partners, and other stakeholders to estimate potential requirements for essential supplies to respond to the current pandemic of COVID-19. Although it gives users with an estimation of the number of cases, this calculator is not an epidemiological calculator. The focus of this tool is to forecast essential supplies. It includes estimation of personal protective equipment, diagnostic equipment, biomedical equipment for case management, essential drugs for supportive care, and consumable medical supplies. The COVID-19 ESFT tool is intended to be complementary to the Health Workforce Tools, ADAPT and the Workforce Estimator. Both tools use the same base clinical attack rate ranges and classify health workforce using ILO-ISCO codes, but their outputs are intentionally different due to their primary focus.